Hello, my name is Dr. Karen Kan. I'm a doctor of light medicine and the founder of the Academy of Light Medicine. And I am a 20 plus year veteran, as of this recording, of using the LifeWave phototherapy patches. As a former medical doctor and acupuncturist, I've had some amazing results. And in fact, I no longer practice acupuncture in person because first of all, there's a lot of people who don't like needles. Second of all, I could only needle one person at a time. And it was so much more empowering for each individual to be able to use phototherapy patches, whether it be on acupuncture points or using whatever is in the brochure to get themselves better and out of pain. And I love empowering people. So today's video is around the topic of what do I patch, or what points or acupuncture points may be helpful to patch if I am having a very stiff and painful shoulder. Maybe it feels a little frozen. Now, I've had that before, and I want to give you a little backstory on it because back in, gosh, when was that? 20, I don't remember actually, 2008, I think, 2008. I was overdoing, so I was very busy at work, but also I was doing this cross training. I was, doing pairs ice skating. Let's just say I was very, very active, and I love being active, but probably overdoing. So I ended up with some sort of tear or something in the shoulder. And I was using the LifeWave patches we had at that time. And, things were stabilized. However, it wasn't as optimal as I would like. Probably would have been helpful if I did not insist on doing death spirals, which requires me to hang off my partner's arm on the ice doing a spin. Yes, very stressful on the shoulder because I wasn't doing it correctly. So one of the things I've learned, and this may be really helpful for your phototherapy patching journey, is that at the time I was undernourished. Now, what I meant by being undernourished is not that I wasn't eating enough. Clearly, I love to eat, so it's definitely not a problem. But what it was I was so active and there was a lot going on in my life that I was actually mineral deficient and had no idea. So the fascia, the tissues were actually starving of hydration and minerals. And so even my response to the patches was less than optimal because the electrical system, if you will, is optimized when there's enough hydration and enough minerals on board. So that's just a little tip, especially if you're stressed out, because, for example, magnesium is used up a lot during detoxification and stress, and it's involved in 325 different enzymatic reactions in the body, probably more than that. So if you are stressed or have been stressed or you're recovering from something or you're fatigued, you probably might need more magnesium. That being said, check with your natural doctor or your internal guidance system whether or not taking more magnesium or using magnesium oil is for your highest and greatest good. And there are other minerals that you might be deficient in, zinc being a very common one, and even sodium. We're not talking about table salt, we're talking about like quality sodium chloride, and because it happens to accompany like 80 something other minerals. I use a specific brand of Himalayan crystal salt from HimalayanCrystalSalt.com. Forgot the name of the company at the moment. But there are other good salts as well. There's ancient combinations of salt. There is like Redmond's sea salt. Just make sure that you get it from a reputable brand so it doesn't have extra lead, etc. So I do a lot of what's called muscle testing in my Academy of Light Medicine. We teach people how to do it so we can actually assess very precisely exactly what minerals we need. But I just wanted to let you know that if for whatever reason in your patching journey, things are not responding as you expect them to be, because usually it's very, very fast within seconds or minutes, it could be a hydration issue, it could be a mineral issue. So let's go through the kind of the 4 different ways. There's many different ways, but 4 easy ways to address this particular symptom of a stiff, painful shoulder. Now, the first way is what's in the LifeWave brochure, which is the clock method. So this is using IceWave patches. This is what the package looks like, IceWave, okay? And it comes in a set of 2. It comes as a white patch and a tan patch. Now, my little trick, given my 20 plus years of using patches, is that I will take a curl of tape. So it could be masking tape, it could be like got my little pink tape dispenser here, and I will put the patches or put this curl of tape on the back or front of the patch. Doesn't really matter which one. So I'm going to put it on the front so I don't peel off the backing. Okay, so I'll put a curl of tape on the front of the tan patch, and then I'm going to put another curl of tape. Now, if you're extra fancy, you want to spend the extra money, go ahead and get double-sided tape, but you will have to take it on and off and on and off depending on how many times you do this part of the strategy. So in the clock method, we're actually going to put one of the patches on the pane and then move the other patch around like the clock, around the clock at 12, 3, 6, and 9. Now, before we demonstrate that, I did want to let you know that this patch, Aeon patch, has absolutely been transformational for my former patients when I had an acupuncture office. Why? Because it helps with that stress feeling, and I've noticed that it helps with a lot of inflammation reducing as well. So in this case, I'm not using it over the pain point. We'll do another strategy where you do. But this one is for something I call brain balancing, so balancing the nervous system. So one of my cheats before I even do the clock method, because I found it works and it's faster, is that I'll put a little curl of tape and say there's somebody I'm demonstrating on. I'll put it on the Aeon patch, and then I'll put it behind the right ear, like so. So that is a calming point, but it's just a really great brain balancing point. And if you have hair like mine, you can't see it. So it's kind of out of the way. And now let's do the clock method. So I've got this brain balancing point. Hopefully I have drank hydrated, right, with water, perhaps minerals if you need it. And then what we're going to do is put the patch on the pain. Here is another tip. It is possible if this is a chronic condition, because a lot of times by the time it gets stiff, we're talking weeks and months for some people, right? The longer you've had it, the more likely you are to have, in Chinese medicine, called like a deficiency syndrome. There's not enough energy and blood and energy flow through the area. In the brochure that you get with the patches, they will recommend that you put, we'll say that this is the shoulder that is the problem, which it was previously for me. You put the tan patch over the pain area, and then you rotate the white around, okay, at 12, 3, 6, and 9. If you've had your painful shoulder for many, many weeks or months, you may want to start with the white patch instead at the center of the pain. So that's a tip. For chronic conditions, you might need the white patch. Why white over tan? Well, the white is more yang, if you will, the tan being more yin. So the yang, is more energetic, and that can be helpful for more chronic type symptoms. So for the purposes of this demonstration, I'm just going to use what's in the brochure, which is the tan over the pain. Then what you do is you put the other one, here's where the tape is really helpful, at the 12 o'clock position. Doesn't matter if it's an inch or two or 10 inches above or a foot above, it doesn't really matter. But in this case, we're talking shoulder, so I'm just going to put it on top here, arbitrary spot at the 12 o'clock. If you're looking at me, it's the clock, right? And you're going to wait 10 to 15 seconds. Now, ideally, you have already figured out how bad the pain is, how much movement you have, and then do the patching, right? And after 12 to 15 seconds, recheck, move again, see where your pain levels are, and just make a mental note. You can even jot it down. If it's not changed, for example, you can go to the 3 o'clock position. So I'm going to put it there in the front of the shoulder. Again, wait 10 to 15 seconds, and then move around and see where you're at. What is your range of motion? And note if that's any better. Out of 10, 0 meaning no pain, 10 meaning the worst ever. And then the 6 o'clock position, right? Do the exact same thing, 10 to 15 seconds. And then last but not least, the 9 o'clock position, right? These are arbitrary. I could put it closer, I could put it further away, it doesn't really matter. So each time you're going to recheck the pain levels and the range of motion. Here's another tip. Oftentimes, the range of motion will improve before the pain comes down. So I can't tell you how many times we've done this little clock protocol or strategy in the acupuncture office. And what I love when I do this, and I taught my nurses to do this as well, so all you clinicians who have a helper, you can do this as well. I love it when there's a loved one, a friend, a family member there, because this is what I see. Okay, so we'll say how bad's the pain, and this is often what I say. Oh, it's really bad, doc. Yeah, how bad's that 10? Oh, it's an 8. It's an 8. I said, you can't lift your arm any. Nope. So they're doing this. All right, they're doing this. So then we patch them up. I won't put my patches back on for demonstration purposes, but patch them up. And like I said, I love having that witness there. Said, how's the pain? Well, doc, it's still an 8. It's still real bad. I started laughing. Right? The loved one is like, are you kidding me? Look at how high you can raise your arm. And they're like, yeah, but it still hurts. Now, so the tip is oftentimes I'll have people move their arm. I'll see how far they can move, right? Said are you 8 out of 10 now? Oh, when it's only 6 out of 10, but when I move, it's 8 out of 10. And then I give them that possibility. It's possible that your pain might not go down before your range of motion gets better. So that's a possibility, just letting you know. So, but I love having the loved one in the room because they're like, are you crazy? Your arm's moving so much better. This is so much better. Oh, I don't think so. Anyway, and this is a compensation. The scapula moves because they can't actually mobilize the shoulder joint. Okay. So that is one strategy. You got the Aeon behind the ear, you're doing the clock method and doing what works, right? Whichever color is in the center, the whiter the tan, move it around, check it. Now, the other strategy I'd like to share with you is one that David Schmidt had popularized, and that is using our X39. Yes, our X39, and we have a supplement as of this recording. Celergize is a supplement that we use as part of the LifeWave family, and in combination helps to activate through GHK copper peptide that you make in your body, just better with this on, to help activate the stem cell enhancement in the body so your body can start to rejuvenate itself with help. Okay, so what does David Schmidt, our CEO for LifeWave, say to do? What he says is a really easy way is go ahead and take one of the X39 patches, and then you're going to put it behind the neck, on the bump on the back of the neck. So on the doll here, it's just right here on the bump of the back of the neck. That's the spinous process for C7. The alternate is below the belly button. These two are in the brochure, so right below the belly button, okay? That is conception vessel 4 or 6, depending on how low. Doesn't really matter which one. Just pick one. Okay, you put one X39, and then you take the Aeon patch. Now, I know you're like, but Dr. Karen, you have one behind the ear. Well, you could take that one off, or you could use the second one. That's okay. And it looks like a white patch, right? But it says Aeon on the back. And you place the Aeon over the most painful spot. So now you have X39 back of the neck or belly, okay, one of the two. And now you have Aeon. And what we've seen in some of the photographs, the thermographic photographs, is that the area of inflammation just resolves, or a lot of it goes away with that Aeon. It affects a huge area, even though it's one tiny little patch. And if you're worried about someone being overly stressed, maybe they need some brain balancing, you could also place an Aeon back there. And here's another tip is if they're like, wow, this is really great, right? They get great results. And you're like, I don't know, do they need the brain balancing one or don't they? You can always take that one off, the brain balancing one off, and just wait. Talk to them, wait, have them recheck, right? In a few minutes, they're like, oh, the pain's coming back. It's not as good. Oh, really? Okay, well let's put the stress handling one back on. Let's see. Yeah, and then you talk to them again, and they're, oh yeah, it's better now. That's how one of the ways if they actually would benefit from the Aeon patch being near the head, the brain bouncing point. Okay, so that is strategy number 2. X39 and midline, front or back. Actually, doesn't matter where you put it, but I like midline for David's suggestions. And then you put the Aeon where the maximum area of pain is. Okay, so that is strategy number 2. Now, strategy number 3 uses a special acupuncture point called stomach 38. Okay, so this is weird because it's on the leg, and you're like, how does this make sense? Acupuncture's like that. Sometimes it doesn't make sense. You can literally, like, poke something down in the foot and it does something to your head, right? It's just, everything's connected to everything. So in this information highway, stomach 38 can connect with the shoulder. So a lot of acupuncturists will use stomach 38 to affect the shoulder. Now, oftentimes it's on the same side, so you have a couple choices. You could always use the opposite side. I think it's whatever works. So I'm not, big on you have to have it a certain way. You know what I mean? Now, you do have 2 stomach 38s, mind you, but if you're going to use a single one, for example, how do you find stomach 38? Well, it's almost right in line with the shin bone, just slightly on the outside, just like a wee bit on the outside. It's halfway between the ankle bone approximately and the knee. So if you go halfway, it's right about there. Okay, right about there. You can look it up on the internet as well. Just type in acupuncture point stomach 38. You'll see the measurements. Don't worry, you don't have to be that precise. It's not a needle, it's a patch. So the question is, what patch do you put on there, right? So if you have the IceWave, because that is helpful for pain, I like to use the IceWave, but you can use different single patches if you'd like. So, for example, you could use a tan over wherever the pain is, right? And use the white over that same side, stomach 38, on the leg. Remember to hydrate and see how that feels. Maybe give it, it's not the clock method, so maybe give it a good 10 minutes. Now, if it's worse, if it's feeling worse, here's another tip. Change the colors. Got that? If it makes it worse and you're using IceWave, swap the colors. So then you would put the white on the shoulder, okay, and the tan on the leg, stomach 38. Now that is the easy, simple way to do it. You could always patch both stomach 38s. In that case, you can use energy enhancer. You could use the IceWave, white on right, tan on left. And then if you've already used a set of IceWave, you could then put an Aeon here or an X39 here, or even a carnosine patch here. Carnosine is really helpful for wound healing and things like that. And sometimes when the body is kind of that dry, brittle, tendon or muscle or fascia, carnosine can be really helpful. My husband used to say it's sort of like plumping up a raisin back into a grape. So you can look up carnosine, you make it in your body. This just helps you make it at better, useful levels. So that might be helpful as well. I think it's really safe for you to experiment. This type of symptom is really difficult to deal with. It is not easy. It certainly wasn't easy when I had difficulty raising my arm, right? So I think you do what works. So I'm giving you some strategies. The last strategy I want to share with you is a little bit more complex. And this is using sacred geometry. So what do I mean by that? Well, it's like the shoulder joint. It's one of those joints. I mean, you have there's a lot of potential range, in the shoulder joint. So one of the things you can do is you can beam the energy specifically surrounding the shoulder joint. So you could put a patch in the front, a patch behind, okay, on either side of the joint, a patch on top, and a patch here. Guess what? You just made a pyramid. Now, it's probably not that comfortable to put a patch underneath to make, a double-sided pyramid, but I'll show you what that looks like. So here's where the extra tape is helpful because sometimes it's not sticky anymore. So for example, I could put an IceWave, white on the front. I can then put an IceWave tan on the back, like so, okay. I can put an X39. Maybe I'm like, hey, I want that signal to for my body to make GHK copper peptide, right? Maybe I put it up here, and then maybe I go, well, let's see. I would like a carnosine here. Let's try carnosine here. You can use glutathione, carnosine. You have a lot of choices. So it's all about experimentation. So I'm going to put the carnosine. We know it helps with wound healing. So now I've got, can you see that three-dimensional pyramid? It goes right through the shoulder joint. So you're actually beaming energy through the shoulder joint. Again, test, 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 see what increases your range of motion. I know some of these strategies take a little bit more time to test, but certainly worth it getting results, right? So you can go from simple to more complex. This is the more complex version. Now, fourth strategy, but even a little bit more complex, we've had some people that have multiple things going on in their body, including they have shoulder pain, but they also have hip pain on the opposite side. So that tells me the fascia is out of alignment and things are pulling. And at the same time, there is a strategy called the reciprocal patching strategy. I have another YouTube video related to that. And unfortunately, the mapping for the reciprocal is a little bit tricky to get. It's part of a course and I don't have it. But the idea is the shoulder and the hip map as reciprocal. So the front of the shoulder maps to the back of the opposite hip. The side of the shoulder to the side of the opposite hip. Okay. So what do? Well, you could do it simply. You could do simply with a patch on the shoulder of any color, and then a patch on the reciprocal, right? So if it's the front of the shoulder, then it's the back of the hip. If you happen to have symptoms in the bum area or the nerve area, the sciatic nerve here, you could do that and trial it out, right? The more complex version is what we have here, where we have a pyramid or even just, the back and front, right? And then we do a similar pyramid on the opposite hip. Now, this is much more complex. Do not start with this one, okay? Start with the simple ones first because there's a lot of playing around. Which one should be up? Which one should be down? I would say, get some movement going. And you might want to ask, wow, Dr. Karen, am I still going to use Aeon behind the ear? It depends. I think that if someone's very stressed out, if they had a head injury, it may be useful to do that. And hopefully you will not have to do the complex protocol for very long. And then you can resort to some of the less complex protocols because that's a lot of patches, right? So try the first four, the simple ways first. And if that does not work, you can try the sacred geometry type of strategy and or the reciprocal simultaneously. So I've given you from simple to complex. If you followed me pretty much all the way so far, please let me know how that sits with you. Give me some comments, give me a thumbs up if you like this video, and please do subscribe to my channel. We have lots of other really cool things happening here at the Academy of Light Medicine and our patch training team. And of course, if you are brand new to the idea of phototherapy or some of the other offerings that we have in LifeWave and do not have a brand partner slash distributor to work with, be happy to have you on my team, become a customer. We do a lot of different things very specific to the patch training team, including webinars, weekly Q&As with me, and we have a beautiful team that can help support you on your patching journey. And I am there as that foundation of support, having the 20 plus years of experience in not only the patching aspect, but also in the business, and would love to support you if you don't have someone else to support you at this time. So just go to the link below, patchtrainingteam.com, and we will connect with you there. A lot of resources there. Check out my blog there as well. And again, if you have found this helpful, hit the subscribe button, give it a thumbs up, and feel free to share with others. We'll see you next time. And if you happen to have a question for me and you'd like me to do a video and I haven't done a video on it before, you can also contact me at patchtrainingteam.com and I'll do my best to get a video out. All right, take care.